Welcome. I'm Nedra Knirk, President of Future RGV, and I want to welcome Vanessa Saenz, who is Vice President of Behavioral Health Services at DHR Health Hospital, and Rebecca Ramirez, who's Director of the Hope Family Health Center and a licensed clinical social worker and psychotherapist. And both are adjunct professors at UTRGV. And of course, Rebecca worked with Future RGV on the Parenting Your Cyber Teen forum that we did back in 2019. And first, I want to thank our sponsors, uh, our Future RGV sponsors who help bring these discussions to you. And this discussion and those of other Valley leaders are on the Futura RGV Facebook page, YouTube, and social media for further viewing. And our Futura RGV moderator is Felipe Salinas. And Felipe will discuss with Vanessa and Rebecca what we are learning to help us cope with this pandemic and suggestions to soften the effects of the stress that it creates. And now, Felipe, will you and our guest help us understand the stresses of this pandemic and some suggestions and help on how we might deal with it? Felipe?
Thank you, Nedra. And hello, Rebecca, and hello, Vanessa. Welcome, and thank you for joining us today.
Thank you. Thank you all for having us.
Yes. So, as Nedra said in her introduction, both of you work in the healthcare sector here in the Valley, and one common thing is that you work in integrated behavioral health and in mental health and behavioral health areas, but you also work at very different institutions. So I think maybe it'd be interesting to kind of hear from each of you how a large organization like Doctors Hospital, DHR Health, has what you've seen and how you have managed, especially from the behavioral health side. And then we'll listen to Rebecca and kind of talk to us from the perspective of a community-based clinic that also practices integrated behavioral health. So let's start with you, Vanessa. Over the summer, we all saw the news reports about this situation in Valley hospitals. And of course, the coronavirus is still very much with us. The pandemic continues. So can you just walk through us how DHR Health approached the pandemic, especially in your area of behavioral health? How would you characterize the approach that you took at DHR to try to help, deal not only with the physical effects of the virus and so forth, which hospitals do, but can you talk to us a little bit about how DHR Health approached this?
Sure, definitely. So I would definitely say that DHR took a very proactive, forward-thinking approach. I think we all kind of had to. It's something that took us all by surprise, and so DHR took action in early January, beginning to monitor. The situation as March, quickly approached thereafter. DHR then, when it became evident that the pandemic was definitely progressing and was, going to be a threat to all of the areas here in the United States, we quickly started to work towards looking at it from the health perspective, right? How was DHR going to be able to respond to this in a way that's appropriate for our community, and especially with the limited resources that we have here in the RGV. And so right away, we expanded and opened up a 57-bed unit. And so we had that bed, that we expanded out the 57-bed in June. So we started off in March. We opened up the first COVID unit in March. It was offsite. Actually, I believe that one was a little less. I think we started out with, I made a mistake, but I think it was like 24 beds. So we had a few beds. We put them off site. We quickly expanded in June and had 57 beds. By the end of the pandemic, or not the end, I'm sorry. I wish we were at the end.
Mm-hmm.
By the time that the pandemic progressed in the summer, we were at over 300 bed capacity to accommodate COVID patients here, in the RGV. And so it really served us well to be prepared. I think one of the biggest things was that people still have accidents. There are still chronic conditions. There's still health problems that exist that need to be addressed, COVID or no COVID. And so DHR made the decision right away to have these standalone COVID units as a way to try and help the community feel comfortable during a very scary time. We didn't want individuals to feel like they needed to neglect their medical care in fear of COVID. And so that was one of the ways that we thought we could address this and really try and encourage everyone to continue to keep their physical health, in mind. And so with the behavioral health component, it was no different. I think everybody was very scared at the beginning. We saw a huge decrease in the number of individuals who were being hospitalized or even receiving outpatient care, which was a little concerning because that meant that these needs didn't go away. It's just that they weren't seeking out the care because of fear, rightfully so. And so that's one of the things that DHR has really focused on, is trying to continue to promote health and wellness in our community while also promoting safety and making sure that everybody feels comfortable receiving that care setting that's going to be safe.
Okay. So Rebecca, from your perspective, Hope Family Health Center, you all are characterized as a safety net clinic, I guess, at the community level. How did you all adapt to the pandemic? We just heard Vanessa say that the hospitals was concerned about making sure that people's basic needs were still being met for other medical conditions. Did Hope Family Health Center continue operating throughout this time? Did you all have to adapt things? And then if you could speak a little bit about your approach to what some of the issues that you're seeing from the people you're seeing related to the pandemic as far as behavioral health also.
Sure. So in March, when we really, I think that COVID came and really hit the Valley really hard, we leadership of the clinic, the board of directors, and all of the staff had a meeting and sat down and decided how we were going to approach this. We knew that we provide medical services and behavioral health services and care coordination and peer support. So we have a lot of services, and we serve the uninsured 100%. And we know that being uninsured, a lot of people go without medication. A lot of people go without primary care and preventative care anyway. And so when a pandemic hits, the fear that Vanessa was just talking about, the fear to come in for your basic needs, we were really worried about our patients putting that off. So what we did in March is we immediately sent all of the psychotherapists home to do telemedical services. They see patients via the computer and via the telephone. A lot of our patients, while we were doing a very good job in the Valley of making telemed services available, a lot of our patients don't have the capacity at their house to have a computer or a phone to just because connectivity. So we've been seeing the majority of our patients over the telephone, which has been a great benefit. Since March, we've had 89% of patients being seen over the telephone for our therapy services. On the medical side, we closed the clinic for 1 week in April so we could revamp how we were going to see our patients. Then we started seeing patients for lab work in-house and telemedical services for our primary care. We do have, all of our doctors are volunteers, and because a lot of our volunteers are elderly or have conditions that really don't allow them to see patients face to face, they haven't been volunteering. So we have one full-time PA that's been seeing patients over the phone and via Zoom or DocSeeMe. We have the residents from UTRGV seeing patients Zoom or DocSeeMe. We have to stop doing lab work in-house just because of for the safety of our patients and our staff. We did have some COVID cases within the staff, which was difficult to work with since we are such a small staff. But we stopped seeing labs over the summer, and now we're seeing labs again, or taking labs again. We have started seeing patients face to face again. We're still doing telemedical services and seeing 8 patients per day face to face. One of the things that we have been seeing is there is that fear to come to the clinic. We don't allow people to come into the clinic. We have them call when they're in the parking lot so we can take their temperature. We can ask them the COVID questions for their safety and for the safety of our staff and our volunteers. But we have been seeing more patients filling out applications to be our patient, or more community members fill out applications. We would on average have received 5 to 10 applications for new patients per week. Now we're seeing up to 20, up to 25 new applications. So we know that there's an increasing need in the community for medical and behavioral health services. What we're seeing on the behavioral health side of the clinic is we see family stress, depression, anxiety, loneliness. We have been seeing many first responders call and ask for assistance of how to deal with the grief and the feelings of overwhelmingness that they're having. Our peer support services, we were previously having groups. Now we're providing some groups online on Facebook, and we have a warm line where people can call in and talk to somebody. They have an ear, somebody just they can talk to, not a counselor, but just they're having some stress in their lives. They just need to get it out. And we really do encourage that as well.
So you touched on some of the conditions, some of the mental health things that you're seeing, the grief, loneliness, and so on. Vanessa, would you like to comment on that? What have you all seen through the behavioral health services at DHR? Is it pretty much the same, or would you add anything to some of those situations?
So I would definitely agree. We have seen, definitely collective grief, as a community. A lot, we do have a pediatric unit. So our inpatient psychiatric hospital it's 87 beds, and we treat, children, adolescents, adult, and geriatric patients. And so one of the things that I've noticed with our pediatric patients is just the high level of stress directly related to such a vivid change in their day-to-day lives. You're talking children are very social, human beings, and we all are, right? But children in particular, they really build upon those social relationships with their peers. They look forward to things like sporting events and homecoming, and for the little ones, t-ball, and just they live very social lives on the day-to-day. And so many of them now being confined to their homes, for the safety and security of their health, has been a huge change. And so that's brought on a lot of stress. And so when you add that stress that is typically managed well by a child, that doesn't already have underlying psychiatric or psychological conditions, you can really see how adding in something like this pandemic and the stress from the pandemic can really exacerbate some of the symptoms that they're experiencing. And so as a result, we've seen children hospitalized with increased depression, anxiety, and adjustment disorders. We've also seen that there has been an impact because they're not able or out of, again, fear of going out to see their psychiatrist. They're not taking their medication. So some of the ADHD symptoms have also exacerbated, which manifests in disruptive behaviors in the home. Parents are unable to manage or very distracted in the class. It's already difficult as it is to have an attention span of a child last longer than a few minutes, and that's face to face. So you can imagine that the distance learning, the online learning, has been a real struggle. And again, I just think it's definitely been somewhat of a snowball effect, just one thing leading to another. But the pediatric population is not one that many would consider to have been impacted, but we have seen that they have been impacted. And our adolescents as well, suicidal ideation, the support that many of them had in their peers or in their teachers or counselors at school, it's not as easily accessible to them now because of the distance learning. So take all of that together, and it's definitely been very challenging.
So, that's interesting. You brought up about the pediatric population, the children and teens. I was just talking with a couple of my family members just last night. We were chatting about that very issue. I'm wondering, I want to ask you both, trying to think of similar catastrophic things that have happened in recent history. I mean, the thing that comes to mind, first of all, is 9/11. And that probably had an effect in the psyche, I guess, or however you would call it, of a generation, how they thought about the world and threats and so forth. do you think anything, I mean, we were just speculating last night among my sisters and I about, I wonder if we're going to see, if are you already seeing, or can we expect to see something like that happening with such an extended isolation and the separation that's happening with kids not being able to bond in these formative years? I mean, do you have concerns about that? Do you see any evidence of that, or what are your thoughts from your backgrounds in behavioral health? Rebecca, would you like to comment on that first? Do you think that's going to be something we're going to likely see?
You know, that's an interesting question, because that's a conversation that's happening a lot in the mental health community right now about the lasting effects. It's the lasting effect of trauma, even if it's vicarious trauma. We're all having a trauma right now of our lives changing, and grief and loss of our lives before this. You know, we all talk about, any of us who are around during 9/11, we talk about life before 9/11 and life after 9/11. I can remember when I was younger and there was a mass shooting in Columbine. There was life before Columbine. There's life after Columbine. All of these things have a real effect on how we approach our world and how we see it and how we view it. So the conversations right now are, how is this extended loneliness, extended fear, extended isolation going to affect the children? And I think that with children and adults, but the children, I think that it does have the opportunity to have a lasting effect, just like repeated trauma has this lasting effect on anybody if it's not treated or taken care of. And there's things that we can do. We can really help children and adults who are experiencing this know what they can control, what they cannot control, help them appreciate the things in life that we can still really appreciate. There's still so much going on that is joyful. Limit what we're seeing on social media, on the television, really taking steps now to reduce the amount of trauma that we're all experiencing. We're not going to see this go away anytime soon, unfortunately. Even if there is a vaccine, we don't know what's going to happen. We don't know when this is going to happen. We don't know how that's going to look. But preparing for the future and giving the kids and the adults the tools that they need to cope with these feelings of anxiety, these feelings of depression, these feelings of loneliness.
Vanessa, would you like to add anything on that in terms
No,
of?
very well said. I completely agree with Rebecca. I think that as long as we, the good thing is that there are a lot, the mental health community at large is really focusing on this. And so I think that that's providing a lot of awareness and just forums and things like this that are really helping to educate, the public, the parents, the teachers, everyone is really aware of what can happen if this isn't navigated appropriately. So I think that has really helped, and I think that parents are having those discussions with their children and trying their very best to mitigate the risk of potential trauma that might develop if we don't aren't proactive and don't implement some of those coping skills that Rebecca mentioned.
You both talked about, and Rebecca, you especially mentioned about the switch to telemedicine and telehealth and so on. Do you all see that this is, I mean, we've heard it from many sectors here in the Valley and elsewhere, that businesses are being forced to find different ways to do business. Government's finding different ways to deliver services. It's happening in the healthcare area too. Do you think that are there some of the things that are going to happen as a result of the pandemic you're going to keep on doing? Do either of your two operations foresee that now telemedicine or telehealth or some kind of similar services are going to continue to be part of your the things that you are doing going forward, even after we have a vaccine and things kind of come back to some kind of normalcy? Rebecca, would you like to comment on that?
Yeah, I think that we're finding so many throughout all of this this time, we're finding so many benefits of how we're delivering care. One of the biggest challenges of the patients coming to the clinic is transportation, and some people don't have vehicles, some people can't use public transportation, people live in areas that they can't leave readily. So having that opportunity to see patients either for medical or for case management or for peer support or therapy over the phone or over the computer has been such a great benefit. We will always, I think that from now on, we will have that opportunity for the patients, because we have really had that. It's just been a benefit. It really has been. There are some downsides, of course, for therapy having therapy over the phone with people who live in a chaotic house is difficult. If you're counseling somebody who's going through a domestic violence situation, it's very difficult for them to discuss it.
Sure.
If you're counseling a teenager, they don't want to say certain things in front of their parents, of course. So there are some things that we would have to balance. So I think that we're going to have a hybrid look from now on. When we're ready, our counselors are going to start coming back to the clinic in November. Just one counselor a day, so they have that opportunity for people to come in, but we're still going to continue to provide telemed services.
How about a DHR, Vanessa? Are you all offering more of that? I don't know what the baseline was prior to this, but it's something that you all are doing more of, do you think, going forward?
Yes, we absolutely are, especially in our outpatient clinics. Same situation with our behavioral health clinics and our telepsychiatry. I think that the really, neat takeaway from this has been that a lot of people who may have not considered telemedicine in the past and then, not gone to their appointment altogether versus, the convenience of being able to hop on to a televideo call and still, be seen by your doctor, your counselor. I think that a lot of people who wouldn't have done that, in the past, just out of the unknown or maybe not being too familiar with technology, have now had the opportunity to take advantage of that service. And so I think, as Rebecca mentioned, a hybrid type program is definitely something that we can expect, in the future, even post-COVID. And I think it's really good because it helps us to see some of the benefits and technology that we may have not explored, at least not as quickly or as soon as we have now with the COVID situation.
Right. So, speaking of telemedicine, telehealth, and just the whole behavioral health, mental health area, that's an area that often doesn't get enough attention. It seems like, at least from my perspective, by our legislators. I know it's there, but if you had the ear of our legislators, either in Austin or Washington, Texas legislatures going back in session in a few months, what would you encourage them to do, especially what we've learned going through the pandemic? What are some of the things that this has highlighted from what the work each of you do? Rebecca, in your case, at a primary community-based clinic. Vanessa also that also offers behavioral health services, and Vanessa, from your perspective in the mental health and behavioral health area. If you had their ear, what do you see that we really need to advocate even more for going forward?
I think that I would definitely focus on and discuss with them really the importance of behavioral health options, specifically for the uninsured. We know that there has really been, I think that our leadership has really done a good job of recognizing the need for behavioral health services, but I think that now more than ever, we need to really focus on trauma-informed care, have our legislators and our leadership really understand what trauma-informed care is, and that we are going through this traumatic time for everybody. I wish there was going to be more funding for behavioral health, and we all would love more funding for behavioral health. But I think that even the state has done some really wonderful, has made some really wonderful steps of having webinars for people and just making those readily available. I think that there needs to be a better understanding of how the pandemic has really hit everybody. And those individuals who have chronic illnesses, really, we need to address the chronic illnesses that they're having. So there needs to be a lot of focus on preventive care and see preventive care of being mental health and physical health together. I think that there's a lot of time we separate them. So focus on integrated health and have a good understanding of trauma-informed care. I would push.
Vanessa, would you add anything to that?
I think that preventative care is, as Rebecca mentioned, is going to be huge, especially since we can expect that we are going to see some long-term effects from some of the care that was not able to be addressed because especially when the pandemic was full blown and there was a shortage of masks, a shortage of sanitizer, shortage of almost everything, just because we weren't prepared for such rampant impact by. So that preventative care is important from a mental health standpoint. I think that I would encourage our public officials to speak to the impact. I feel that they have a very powerful impact on our community. And so having them bring to light, the importance of addressing mental health and how, highlighting some of the resources that are available, making it known, to the public of, any uh, programs that the state or federal government have available to address, trauma, for example, uh, continuing to fund, education for mental health providers so that they too, if somebody wants to begin or needs to, actually, I feel like a must at this point. Most mental health providers are going to need to feel comfortable treating trauma. And so maybe making some of those trainings more readily available for mental health providers so that they can be prepared to take on, that um, aspect of care once we start to see people engage more in counseling and receive care.
So I guess I would just like to wrap up, I wonder, I would ask each of you could share maybe one thing you've either learned or been reminded of personally as a result of our experience with the pandemic here in the Valley. What is one of your big takeaways, at least at this point, from this entire experience?
I would go ahead, Vanessa.
Sure. Okay. So I would say that the importance of slowing down, while it may seem that we've had to respond, rapidly to changes, and we definitely have, we've also had to slow down a lot, having to enjoy life without some of the luxuries or things that we may have taken for granted on the day-to-day basis, has really been rewarding. Working with your children at home through an entire new norm, helping them, navigate through learning in a way that we never may have, imagined would have happened had it not been for the pandemic. Taking care of our own mental health, while taking care of the mental health of our families, and working together as a community to support one another. I think that one of the positive things that have come from this pandemic is seeing how the community has really embraced one another at times where I remember, seeing on a social media platform, people were posting, I can't find diapers for my child, or, and then the community reaching out and saying, here, I have resources, you could come by, I can meet you somewhere, just that humanity, the empathy, and the ability to connect with one another during, a time that is very difficult and challenging, and a transition that is not easy. I think that has been amazing. And so seeing everyone come together and realizing the importance of being there for one another, and at the end of the day that we're really all that we have for one another when something like this happens. I think that has been very beneficial and has brought to light the importance, of slowing down and embracing one another.
Rebecca, how about you?
I would agree with Vanessa on really just really appreciating this wonderful community that we live in. People have been embracing each other and reaching out to each other in different ways that we've never seen before. And I think just showing how close knit our community really is. We can be divided on so many different things. I mean, there's so much going on in the world that we can be divided on. But when it comes to making our community a great place to live, people do really look out for each other, from businesses to hospitals to our neighbors. It has been a really great thing to take a step back and to appreciate. I would also say that I've taken this time to really appreciate the time that I have with my family. I had my children home homeschooling, and I'm very far from being a talented teacher. So I learned a lot of patience and a lot of self-care and a lot of self-maintenance. And I think that if we look at all that and how our lives are changing, but then we really take a step back and know that I would never have had this time to spend with my kids, or I would never have had this time to reach out to the community in a different way. So it has been a really, it's been a blessing in disguise, having the kids home. And then really having that opportunity to talk with them about what's going on, and knowing that it is a scary time, and being able to know that we can help mitigate what they're seeing and how they're handling it. It's been a nice time to spend with them.
That's great. Well, thank you both, especially for helping, calling to everybody's attention, about the resources that we have in the community, and not to ignore the signs when we do need to reach out to get some help. And hopefully we can speak and continue advocating for the kinds of resources that we need here, especially in an area like the Rio Grande Valley, where so much gets in the way of people taking advantage or seeking out this kind of assistance when they need it. So thank you both for joining us today.
Thank you for
Thank you
having me.
all.
Nedra,
And I
back
would
to you.
like to add, Vanessa and Rebecca, we very much appreciate you being on, but I would like to invite both of you. No, I'll change that. I would like to plead that both of you would share some of your insights and suggestions that you think might help people with future RGV, so that we can post them on our Facebook page. I know you have many resources of your own to reach out, but maybe we could reach some additional people. And if you have any ideas or tips or suggestions that you think might just help people, we would love to post them on our Futuro Facebook page. And maybe we can, as you say, we have a very close and supportive community in the Rio Grande Valley, and let's help them in any ways that we can. So once again, thank you so very much. And thank you, Felipe. And I hope that we see and hear from you again.
Thank you so
Thank
much.
you.